Okay, great. Welcome everyone to the healthcare panel. So we're going to spend just a few minutes up here where I'll moderate the conversation and ask the panelists just a couple of questions. And then we really want to go to you, the audience, to hear the questions that you would like to have asked. We noticed at this morning's panel, there were a lot of hands in the audience that didn't get to ask their question. So we're going to try to keep my moderation short so we can get to your questions, okay? So AJ, we'll start with you if that's okay. I think you need no introduction, so you can keep that part short. But after your introduction, in your view, what is the biggest impact that you can see AI having in healthcare? And specifically, how can cognitive AI impact healthcare? And if you'd like to go a little bit further, what is your view specifically on AI in healthcare in Jordan, in the region?
I'm actually very excited about the potential of AI and cognitive reasoning in healthcare. My colleague, Dr. Wael Barsoum, talked today about the potential. We're generating a lot of data and infusing data with human knowledge. Ladies and gentlemen, the knowledge, human knowledge, is still very relevant. I think we got very exciting opportunity, again, when we're fusing data with human knowledge to basically explore many, many discoveries. We have found AI, especially in the field of machine learning and data crunching, we made significant impact in terms of image processing, in terms of many areas in that field. I believe adding the cognitive reasoning layer on top of that is just going to create a tremendous opportunities there. I also want to add, at Beyond Limits, we really believe the next big opportunity in healthcare and in other fields as well is the collaboration between human and machine. Human is still relevant. You're going to hear that from Beyond Limits. Human is still relevant in the equation. And I think we're going to see many, many discoveries where collaboration between machine and human is going to advance the cause in healthcare. I still want the surgeon in the operating room. I still want Dr. Barsoum to be the surgeon that operates on me. But I think it's okay for Dr. Barsoum to be assisted by cognitive agents. Dr. Barsoum talked about it this morning, you know. I believe he said medical knowledge, I believe, is changing every, how many days?
73 days.
73 days. How do you expect doctors to keep up with that? You know, let's let machines, it's good at that. Let's let machine keep knowledge, keep track of that progress. But ultimately, let's make the doctor make the ultimate decision. We're very excited about that opportunity.
Thank you, AJ. So that was an excellent segue to you, Dr. Barsoum. Excuse me. So what do you see as the biggest opportunity that will come from the Cleveland Clinic Center for Artificial Intelligence? And how do you see the greatest global impact in healthcare utilizing artificial intelligence?
Well, you know, it's interesting is when you look at the delivery of traditional healthcare, I would argue that there's no place better than the Cleveland Clinic at that delivery. In terms of bricks and mortar, providing you with a doctor, as you heard from the last speaker, sick care. I mean, this is really what we have historically excelled at. And it's hard to disrupt yourself when you're already very, very good at what you do. But to the credit of the organization, we've recognized that that model of healthcare is quickly becoming outdated. And the fact of the matter is we have areas in the United States that are vastly underrepresented when it comes to high quality, low cost care. So what I think is going to happen in our Center for Artificial Intelligence is going to be an ability to look more and more at how we can provide Cleveland Clinic quality care around the globe, regardless of where you are. So through things like telepresence, through things like augmented reality, through things like artificial intelligence, we will be able to take the very best of healthcare from around the globe and provide it to everybody, regardless of where they are. You know, it's interesting how many people have a smart device, how many people have a smartphone. You know, if we simply use that as a tool to deliver healthcare, high-quality healthcare at a low cost across the globe, we can alleviate so much human suffering that it's unfathomable. That's what I think we'll do.
Fantastic. Thank you for that. So, Dr. Habashne, since the audience hasn't heard from you today, it would be great for you to give a couple of minutes introduction and your background. And then if you could answer 2 questions for us. One is, what do you see as the biggest challenges for Jordan to widely adopt AI for healthcare? And what do you see as the biggest opportunity in Jordan? And then tell us a little bit about your experience at the Jordanian Royal Medical Services, and how do you see AI impacting RMS in the next 5 to 10 years? So over to you.
Well, thank you very much for this question. But let me start by thanking for giving me this opportunity to talk about healthcare system in Jordan in this important events.
Yeah.
As you all know, despite all challenges, Jordan is well known for providing quality health services for everybody in Jordan, Jordanian residents and visitors. Also, Jordan is well known for healthcare tourism in the area, in the region. But let me give you brief and figures and numbers from Jordan healthcare system. We have a population in Jordan of 10.4 million, and 54% of the population is under the age of 24 years. And recently, we noticed that the life expectancy has risen to 75 years. And what we have, hospital bed in Jordan, around 14,500 beds. The Ministry of Health, around 5,700, Royal Medical Services around 4,000. And you know that the GDP is around $40 billion. So the total expenditure on healthcare is almost 7% of the GDP. And the medical insurance coverage is about 70% of Jordanian, which they are covered by many organizations, such as the Royal Medical Services, where it's provide services for not less than 38% of the population, and the Ministry of Health, 41.7% of the population, and the private insurance, 12%, and the university hospital, 2.5%. So the major challenge impacting the Jordanian healthcare system, as I see that rapidly growing population, and especially with large number of immigrants from Syria, Iraq, and Palestine, and others. And again, we talk about the economic constraints, which really a very big challenge in Jordan. And the impact of challenge on the ground that we see now, crowded facilities, that when you go to our hospitals, you see that the hospital is very crowded and very busy. So that leads to poor patient satisfaction. From this, we can see that it's indicated to improve the quality and to improve the services that we give in our hospitals or in the health care system. The potential changes in the use of AI in Jordan, I think the high initial investment, as they said in this morning, in acquiring AI systems and tools. This is very important. And other things, the ethical issues where there is a third party, which is the machine now between the doctor and the patient himself. And as I see a lot of resistance among the healthcare provider to adopt AI, and fear of relapsing, replacing the human workforce by machine. This is really, we face it a lot in the hospital and from the worker in the health sectors. And the data privacy and security and mobile healthcare application and devices that use AI and the cyber security issues. But regarding the experience in the Royal Medical Services, which is the Army medical arm, are considered as a major provider for secondary and tertiary healthcare service. And King Hussein Medical Center is considered to be a referral center for all other sectors in the kingdom. Therefore, to ensure that patients are getting best available healthcare services, RMS is concentrating on training people and sending a clinical team to the top centers in USA and Europe and Australia and Canada. Also, RMS Royal Medical Services Management has also been pushing to acquire the latest medical equipment technology and systems such as the MRI and CT scans and the PET scans and other sophisticated specialized equipment. For example, in 2006, the Royal Medical Services installed the first picture archiving communication system, the PAC system, at the radiology department, and we have it now in the in all our hospitals, and this is there is a lot of huge data which facilitate to make all things simple nowadays. And in 2009, Jordan decided to start healthcare digital transformation by investing in health IT system, Hakim. And Hakim, this is deployment of Hakim now in Jordan at, I think, 190 place, hospital and medical centers, as part of integrating all clinics of other public healthcare system, hospitals, medical centers, and clinics, indicating that there is a clear national e-health strategy for the healthcare sector to help improving healthcare services. And again, in last September 2019, under the patronage of His Majesty King Abdullah II, the Health Data Analytic Program was launched by Hakim to help both researcher and decision maker in the Jordanian health sector by offering artificial and technical solution and tools, as well as implementing analytical solution to support decision. And this health data analytic relies on the huge amount of medical files stored in the Hakim program since it was launched with more than 6 million electronic medical records stored in the system. So finally, at the end, myself, I recommend that Minister of Health, the Director of Royal Medical Services, and other healthcare leaders to move in this direction by possibly establishing a steering committee and to build on what have been done so far, and to start AI project as part of the national e-health strategy, which is an important tool for providing the improved quality and to minimize the cost for provided services.
Thank you so much. Excellent. So, excuse me. Mr. Obada, your company helps organizations adapt AI. How do you help highly regulated industries such as healthcare overcome their reservations about adopting new technologies such as AI? And in your experience, what are some common misconceptions organizations have about AI?
Answer.
That's
for
okay.
2 questions. Well, first of all, thanks a lot for having me here. I assume that everybody is hearing me. Well, uncertainty in artificial intelligence is a very hot topic these days. Let me just move there. So I was saying that uncertainty in artificial intelligence is a really very hot topic these days. I mean, everybody is trying to improve the acceptance and trustability of artificial intelligence in order to close the gap between top management and bottom management. And we were speaking about this in the previous panel discussion. So there are different kind of practices that we follow basically at Stallion Artificial Intelligence to mitigate this problem, starting with basically offering a defensive design with safety first. So usually we follow basically, because of the diverse experiences that we have in defense, medical systems and healthcare, which are very highly regulated industries. That inspire us basically on how to create basically a defensive approach where we basically evaluate risk at all levels at development and integration. On the other side, it's very important to follow a deliverable-based milestone approach where we basically deliver actionable insights at all phases so that the trust will start to be created inside the organization when you start seeing the value at every stage, basically, of the AI journey. On the other hand, also, I would like to spot the light on having basically a very deep look into the prevention, how to prevent discrimination and understanding the data set biases, basically. So you want to understand really what kind of data you have, assess the maturity of this data. Do you have really biases in this data? If you are trying at a bank or a hospital to use this data to create value, you need to make sure that you don't have any kind of gender inequality in that data. So regarding the misconceptions, again, I would like to echo different kind of speakers talking about artificial narrow intelligence and artificial general intelligence. I believe that today what we have in our hands is narrow intelligence, obviously. We just use AI to do very, very limited tasks in different industries. We don't see right now, or we don't expect to witness any kind of general intelligence. It might be 10 or 20 years from now, waiting at least to have a better memory capacities, data transmitting, and so forth. So today, yes, we do have the AI that can basically replace humans or augment humans in repetitive tasks and routine tasks also. The other misconception that I would like to add is that AI is not going only to replace humans in red and blue collar jobs. It might replace also jobs with advanced degrees. So just everybody needs to be prepared for that. So radiologists, accountants, we need all to be ready for the next evolution. We need to be really equipped with data science skills, I would say, in order to create this kind of human-machine collaboration. That's it. Thank you.
Fantastic. Thank you very much. So before I move to questions from the audience, is there a burning question that any of you would have liked me to ask, or do you have a burning question that you would like to ask one of your colleagues?
Thanks, Megan. So I guess this is more of a comment than necessarily a question, and it hasn't really come up, but I think it's important, especially in healthcare. You know, one of the things that is interesting is the amount of discrepancy between the delivery of healthcare amongst different parts of the globe. Yeah. And not only amongst different parts of the globe, but even amongst our own practices. So one of the things that we aimed to solve at the Cleveland Clinic, probably about 10 years ago, was that you should not get a different treatment depending on who you saw. So in other words, if you saw one doctor because your shoulder hurt, and you saw a different doctor because your shoulder hurt, you shouldn't get two different treatment plans. One shouldn't suggest surgery while the other suggested physical therapy or anti-inflammatories. So one of the strengths that I see in AI is it truly is an equalizer, so that no matter where you are on the globe, no matter where you are, that the treatment that you should have access to should be based on the very highest standards anywhere. And I think that is an opportunity to improve the health, the well-being of all of society, so that no matter where you are, you get the most appropriate treatment possible.
Yeah.
Fantastic, thank you. Any additional comments from our panelists that you would like to bring into the room, or question you would like to ask each other?
Let's open the questions for the audience.
All right, let's move to the audience then. We would really like to hear from you all. I think there's mics. What's happening?
So it's updating, right? Just hit the star next to the question that you want to answer.
Okay, we're going high tech here. It looks like questions are being submitted in real time and I get to choose. All right. Okay, this is an interesting one. It was mentioned several times among the speakers that future jobs are going to be more focused on creative ideas and that jobs requiring low cognitive abilities are going to be futile. All right, what is the future of people with below average IQ and mental abilities of the ordinary? That didn't quite end how I was expecting when I started to read this. I cannot read all of these before I do this. So maybe just focus on the first part of the question around, creative ideas.
So let me try to answer
I
that.
apologize. It's very hard to read all of these in real time and then choose one.
I think the first thing that we need to think about is the fact that every human life has value.
Absolutely.
Right.
Yes.
Regardless of what your cognitive ability is, regardless of what your level of education is, your life has value. And there will be different things and different roles for every person that has a desire to work. I think that's the first thing. Right? We're never going to be in a situation, I don't believe, where we're going to see artificial intelligence fixing our faucets or repairing our cars, that have a mechanical issue. Now, it may help, it may facilitate that, but it's not going to actually take out the wrench and turn the screws. So there's always going to be a role for everybody. So I think that's one of the things that we have to recognize is when we talk about the combination of the human brain and the power of computing, of supercomputing, of artificial intelligence, that is an absolutely incredible combination. And incidentally, this isn't the first time that we've gone through a cycle where people thought that jobs would be replaced. Right? When Olds and Ford came up with the idea of an assembly line, people thought, oh my God, I'm never going to have a factory job. Yet there are still millions of people around the world that work on factory assembly lines, even though we have robots that can do a lot of that work. So I think that's an important distinction and something to recognize, that there will always be work for people that have a desire to work.
May I just quickly add, I agree with you, Dr. Barsoum. The other thing I'd like to add is the beauty about AI is we actually can take an expert and scale that expert across the organization and across the enterprise. So we don't need to have PhDs operating very sophisticated machines. We can have one expert and we can have AI system work with less sophisticated skill set of individuals so we can scale up that organization. So the distribution of knowledge, using AI to allow us to basically use less skilled individual to work on a task will also be very relevant.
Okay, fantastic. That's an excellent answer. So Mr. Abaida, maybe you can answer this question. How can we serve the regions that don't have even electricity with healthcare using AR, VR, and AI? It's a challenging question, but a fair one.
Challenging one.
And anyone else can
Well,
jump
are we
in
talking about sub-Saharan Africa here, or?
There are regions of the world that don't have access to electricity, 1 billion people.
Well, absolutely. I mean, one of the main policies to create a national AI strategy is having infrastructure, right? An affordable, accessible infrastructure where you have basically data warehouses, electricity, something to process the computers to process the data and so forth. So without such kind of infrastructure, it's very difficult to have an artificial intelligence that can transform the industries over there, obviously because there's lack of resources. But I mean, with the widespread of smartphones and because everybody going for globalization, I believe that AI can reach to their hands using those kind of smartphones I mean, each smartphone can be converted into a prediction machine, right? So with AI, I believe this is the only way to reach those regions. Otherwise, the nations need to work hard on building the infrastructure. Yeah.
If I may add,
yeah, please.
So I would encourage you tomorrow, Dr. Maurizio Vecchioni of the Global Good, this is the Gates Foundation, is going to be a keynote speaker tomorrow. The Gates Foundation has done a tremendous job in terms of going after locations where there is no electricity, no infrastructure, and they have done a wonderful job creating entrepreneurs in these local areas to help solve the problems. And they have done a fantastic job. So I would really encourage you to come and listen to Maurizio's example. You'll be surprised. The answer actually comes from the local population in those areas. But a great presentation tomorrow.
Fantastic. It looks like we're getting even more sophisticated. It looks like people are voting on what questions they would like me to ask, which I think is a much better process, so I don't have to sit up here and read. Okay, from your experience, what are the top AI use cases that could be applied on the Jordanian healthcare system? And there's another question here very related to that I was going to read next from a Jordanian doctor saying, how can I implement AI in my practice? How do I start that? Where should I be doing that? So Dr. Habashne, would you like to take a stab at that or pass it to someone else?
I guess he's going to pass it to me.
All right, he's looking at you.
I actually think, there is not a lot of large-scale deployment of AI systems in Jordan. But where I see the opportunity in Jordan is in the entrepreneurs. I've attended a Phi Science conference last year, and I was a judge for a lot of startup companies that competed in actually a monetary prize last year. I gotta tell you, I was really impressed with the depth of ideas and creativity that came out of these startup companies. I think Jordan's contribution to Jordan, to the region, and to the world is gonna come through the entrepreneurial entrepreneurs, ideas, and great ideas that's gonna come out of Jordan. But let's also have a real doctor answer the question. Dr. Barsoom?
One thing, if you want just a very practical way to start applying things like predictive modeling in your practice, and that's really the very first generation of artificial intelligence, and it doesn't require a supercomputer, straightforward, is just get online and look at what are called clinical care paths. So clinical care paths are data supported. They are meant to treat everybody with the same protocols that are based on the best outcomes. A very good idea, a very good place where we see that is in cancer treatment, right? Every time somebody is diagnosed with breast cancer or colon cancer or prostate cancer, we don't reinvent the wheel. We don't say, well, why don't we try this for you and why don't we try this for you? Mm-hmm. There are strict protocols that are based on the very best outcomes that get the very best outcomes. And in the patients where we do try something new, they're enrolled in clinical trials where we review their outcomes, and we use that to help drive the next generation of decision-making. So these clinical protocols are for everything, for total joint replacement, for shoulder pain, for cancer care, for diabetes management. These are all published, they're all open web, they're all available to anybody for free. So I would encourage you in your own practice, if that's something that you're interested in doing, it's a low-tech, easy, zero-cost way of starting to apply true artificial intelligence and true predictive modeling into your practice.
Fantastic. Thank you for that. So, next question. Having an AI expert in healthcare would be challenging since we either study in the AI field or the healthcare field. how to face this coming up with an AI healthcare expert. Would you like to try this one?
Well, I'm going to answer on this question from a management consulting perspective, basically. So usually we work with a lot of enterprises, either from public or private sectors. And any organization, you do have different kind of business units, right? So you do have the accounting, you have, let's say, HR, etc. But what lacks in this organization is the AI unit. Usually there should be always an AI unit that can basically collaborate with all these business units in order to cover that gap. So the healthcare expert is working with the AI expert to come up with basically a use case and that can address their problem. This way, we can create a very basically speedy solution for the problems that we are having right now in our organizations. Otherwise, a healthcare expert alone cannot basically work or build the AI solution. And without the AI engineer, it's very difficult for the whole thing to help to come up with a solution to that kind of use case. So yeah.
So I think we have time for one more question. I'm going to ask this. We may get a pass from the panel. We'll see if someone wants to answer it. It's a popular one. How did AI systems like AlphaZero by Google help in healthcare, in health industry after it succeeded in other domains? It's not made for chess, for example. Anyone familiar enough with the technique to discuss it?
I can address it at a high level. The way DeepMind operated with AlphaGo is an advanced form of machine learning that we call positive reinforcement, which basically it allows you, if you pick the right path, it will reward you for that, going through that right path. And I think this would be very relevant and important in healthcare, in diagnostics, but it's also going to be relevant in many other fields. However, I want to add, you're still looking at data. You're still looking at processing a lot of data, and if you have that, that is fantastic. That's great. But I think it's important also to infuse the knowledge layer to either reduce the data set required or the training. AlphaGo is it's about 1,000 times more complicated than playing chess. It requires, DeepMind with access to all the Google's resources of machines and electrical power was able to do that. In healthcare, we may not have that advantage. We may be limited in terms of the compute infrastructure and the compute resources that is required. We may need to think about reducing our training and data sets. So this is where it's also important when you're tackling a problem, when you're trying to figure out what's the solution, to design the ideal solution that may encompass, using the data when it's relevant and when it's important, but also using knowledge to guide it in the right path.
I think one other thing, that's important to add to that, and I do think it complements AJ's thoughts around the importance of the human and the machine combination, is when you look at AI by itself, without the cognitive reasoning side, it really does not include the human factor. So what do I mean by the human factor? If I see a patient today that I believe needs a knee replacement, and I think can go home the same day, and all of the data from their health supports that they could go home the same day, but I see them in the office, and I see the family squirming and getting nervous that mom's going to come home, and we're not really comfortable taking care of her right away, then you have to make a decision based on the human factor to say, look, although the data may support this, I think in your case it's best that we do something differently. And I think that's the combination, and that's where we will eventually get with cognitive reasoning, but it will take us some time to get there.
Great, thank you. So it's been pointed out to me that there's a couple of people that don't have access to this. So there's someone in the audience that would like to ask a question. Did you all hear the question? FDA trials and AI. Excellent question. Yep.
Yeah, so I can take a go at that. So a couple things. First of all, one of the biggest challenges we have is identifying the right patients for the right trials. AI is a huge advantage for us in doing that. And what I mean by that is, you know, it's second nature for us as human beings to try to do everything we can for our patients. Second nature. But the reality of it is we're sometimes doing them a disservice by not putting the ideal patient in the ideal trial. We may be potentially, at least in our own minds, helping that one individual, but doing a disservice to everybody else because the trial's now somewhat tainted. So that's the first. I think it's choosing the right patient for the right trial. The second, which I think is a risk, is one of the big challenges with the FDA, as you know, is around clinical indications. Right? You get an indication for a certain drug, and you get contraindications, not only by disease, but by specific patient. You know, my colleague is here with me, Ozzy Delgado, he's a PharmD, knows these things orders of magnitude better than I do, so you should probably connect with him after. But one of the risks that I do see with this is that because we can ultimately become so specific in choosing the ideal patients for the ideal trials, my concern is that the FDA may become more limiting in who we can prescribe the medications to. All of a sudden, we become a lot more off-label because the studies are so much more tightly honed to a specific subset of patients. So I think the first part is a huge advantage, choosing the right patients for the trials, because it'll give us cleaner information if we can minimize the variables, you know, our independent variables to get a cleaner dependent outcome. But I do think that the risk is that we will find that the indications will become more narrow.
Megan, if I may just quickly add, it's a great question. One of the things that cognitive reasoning, beyond limits cognitive reasoning does is explain how you got the answer and provide you with an audit trail. Yeah. That explainability and audit trail is going to be extremely important to the FDA. Yeah. Explain to me how you got from point A to point B. I also need an audit trail that will allow me to go back, and if I need to change any of the assumptions, dynamically will change the system. Explainability, audit trail is going to be very important.
Okay, thank you. So this is the last question for the panel, and it's a very popular one. A lot of people are wondering how to incorporate AI in their early careers. So the specific question is, from an industrial engineer, as a beginner, what are the steps that I should take in order to implement AI in my graduation project, pointing that I'm studying industrial engineering? That has 23 votes. I'm sure there's a lot of people in there that have various majors that are wondering how to incorporate AI in their education. Where do they get started? How do they do that? So who'd like to take that question? You want to take a stab at it?
Answer here. So as a member of the National AI Strategy Committee in Jordan here, we are working right now on putting policies and start producing a couple of initiatives that can help basically youth in Jordan to start basically applying AI in their education, engaging them basically in real-life applications in our R&D hubs, as well as basically start provide them with more specialized knowledge when it comes, for example, to providing professional diploma in artificial intelligence. We also are working very closely with the government here to start basically engaging with student hubs, those who are really right now studying at the university and they would like to apply their knowledge into practice because there is always a gap between academia and practice, right? So we want to really work hard on this in order to start bringing, once they graduate from the university, they directly start engaging in the labor markets, and we start creating this AI industry in Jordan in order to unlock jobs, attract investments, and let's say, stimulate the economic growth here in the country.
Anyone else like to comment?
I'll just make a comment on the healthcare side of it. You know, the Cleveland Clinic's a nonprofit healthcare organization. So, you know, we don't have the ability, I shouldn't say we don't have the ability, it's hard for us to hire world-class data scientists and programmers because there are companies out there like Google, like Facebook, like Beyond Limits that are really attractive to those kinds of folks. So if you are in the healthcare space, and I've met lots of medical students today and future doctors and nurses today, if you are in that space and you're interested in getting involved in artificial intelligence, there's a lot of work today around predictive modeling, which from my perspective is really kind of the lowest level of artificial intelligence, but it works, and it works well. And eventually, once you publish a few papers in that area, you will get the interest of folks like AJ, who are looking at expanding their work into healthcare. And then you get access to some of the greatest minds on the computer science side and on the coding side and on the data science side that will open doors for you, because these folks today are in high demand. So you have to some degree, prove that you really have an interest and you have the experience where you can bring some value to the work that groups like that are doing.
Please join me in thanking our panelists for their discussion.